Now I'm in the skin subdermal, and I do all these injections subdermal, never the dermis, because dermis is where you are very likely to get nodules, and we don't want that. So we're done with this. I don't go near the periosteum either, because once you're either on the periosteum or supraperiosteal, you might hit it and start an inflammatory process of the periosteum that leads to a bony type of nodule, almost like a benign osteoma. And those you really cannot treat very aggressively. There's really no solution except for waiting for it to go away or camouflaging around it. So it's very important to stay out of it. In the beginning, when I was doing the temple areas, sometimes I would hit the temporal fusion line right here. That's where you get from the deeper area full of soft tissue to the superficial area which only has frontalis muscle, not much. And that's where the nodules would happen from the bony stimulation. So I realized I really don't have to get too close to that. So once I feel the temple area and the deep area, that is plenty. And I try not to get too close to this area. And I can still get a little bit of brow lift by staying in this area. The volume lifts it up. And that usually is plenty, and it minimizes the crow's feet as well. Again, subdermis, some people would tell you here that you should go all the way to the bone. Not a good idea, because there's always a little bit of vein in here as well, and if you hit the bone, you can get an osteoma there as well, and you'd rather stay away from it. Jane, I'm going to have you hold it here. So, in essence, we did all the areas we had to do in a pretty atraumatic way, and it was very quick, it didn't take too long, and the pressure application ensured that we won't have any excessive bruising. At this point, after another 2-3 minutes, once she's held the pressure, then typically I'll have the patient do icing for 5 minutes. And at the end of the icing, I will come and massage it gently with a little bit of moisturizing cream so the skin is not traumatized, just to even it out. At this dilution of 10 cc's, I do not like to massage aggressively because I'm afraid I might spread it out too much. And I don't get nodules from this typically, and I'm not concerned about that because the dilution is so high. And even if I do get any nodules, those are more like papules. They're very tiny, 2 to 3 millimeters under the skin, and slowly and gradually they go away on their own. If a patient brings it to my attention that they have noticed something on the massage, I tell them to massage it aggressively and try to break it down. And if it is not going away, then come see me, and I will use a combination of a very small dose of Canalog, only like 1 milligram, mixed with a little bit of saline into the nodule and try to break it up, the papule, and it gets better. Even if it does not, I do not get too aggressive with it, because I tell the patient it is about the way you look, not what you feel. It's like a rhinoplasty. Patient might feel something and say, you know, I feel a little irregularity or something. However, we do that for the looks, not for the feel. So if it looks good, leave it be. Slowly and gradually, that little papule will go away. So it has not been an issue. So at this point, how are you doing actually? I should ask her instead of speaking for her. You feeling okay? Great. Any problems? So you're pretty comfortable, you would say? Excellent, excellent, great. Good. So please remember not to do any workout today, and if you can skip today's aspirin, that would be great. And I'll have you do some icing after the next 2 minutes, and then we'll talk more. Okay. So you've been holding the pressure for about maybe 5 minutes now. That's plenty. That's great. So now what I'm going to do is, Jean, I'm going to have you ice your face for another 5 minutes. And your face is pretty numb, so really it should not hurt you. And keep rotating between the areas to get it nice and numb and really frozen. Okay? Great. I'll take these from you, and you can take one on each side and start with the temple area and then keep going downwards. And then I'll come back in 5 minutes, and then I'll do the gentle massage. Okay. And then after that, you'll be good to go. Okay? Thank you. Great. I'll see you in a minute. Okay, great. So it's been about 5 minutes, and Jane has been icing, and it's probably pretty frozen. So now we'll do the massage, and I used to do it just, bare hands. I realized it's pretty traumatic for the skin, and they will get like petechiae. So I realized I need to put a little moisturizer. So I just use plain Vaseline. Not a lot, just enough so the skin remains atraumatic. So we'll get that, and then we'll use a little bit at a time. Okay, great. Just on the fingertips. So Jane, I'm going to do the little massage, and as you'll see, I'm going to be very gentle, and you have to do the same thing at home. And you don't have to be aggressive at all. You're just doing gentle massage to kind of pamper yourself, so to speak. And the main goal of your massage is to find out if by feeling you feel any lumps or bumps. And if you feel any, what you do is just concentrate on that area and try to break it down. If it's not going away in a day or two, then you come see me, and then that's when we do the little injection with Canalog and the saline. And this feels okay?
Mm-hmm.
Great, great, good. Jean, while I'm doing this, do you have any questions about your activities or aftercare?
No.
No, okay. And I have to tell you that some, it's your first time with Sculptra, Jean, some patients get a little soreness, not bad, for anywhere from 2 days to up to a week, and that's normal. That does not mean that you are having any reaction or something. You can take Tylenol for that, or you can ice. Icing works as well. But I've never had anyone who felt that little soreness to last longer than 1 week. As you can notice that despite taking aspirin, there's really no bruising. And that's primarily because she's very relaxed, and also because she applied pressure for about 5 minutes on each site. And you can see that the injection is pretty symmetrical on both sides in all the 3 locations that are injected. And it's also because I make a point to write down the amount of cc's I'll inject, so I don't run out of material towards the end. Great. So that's about it, and this is what you will do at home as well, Jane. And if you have any problems, make sure you call me, okay?
Mm-hmm.
I'm going to wipe off this Vaseline so it's not too shiny. And while I was doing this, I was able to wipe off the white eyeliner as well, that I use a white eyeliner for marking purposes. So let's dry you up, and then we put you back up so you can, and show you with a mirror what it looks like. Sometimes patients have earrings, and if I'm injecting in this area, I have them take out their earrings because it gets in the way. Okay, your chair will go back up, and let me grab a mirror to show you. If you hold this, I will point out what we have accomplished. So we went in the groove right here where the eyes seem sunken, build up a little bit of the cheekbone, did this area because that's where your crow's feet really show up despite Botox. Try to give you a little angle of the jaw. Angle was good here, but you were missing from the earlobe downwards, so we created that. That's very natural. I'm going to quickly wipe this off as well a little bit. Let me get a gauze to wipe this off for you. Great. And then we went to the marionette chin triangle, this depression, and filled it out. And now it's looking smooth. If you notice the transition between your jaw line and the chin is smooth without a dip in the preachial sulcus, and that's critical. That's what a harmonious balanced face looks like. And for future when we do, I will also inject the mental groove. Your mental groove is very deep, and I have to kind of even it out. And that's what we'll do. Any questions at this time?
No.
Great. You feel like if you leave now, you could go to work, or you could go shopping without any hesitation with a little makeup on?
Yeah.
Would you consider that this is, would you think that this is like a no downtime procedure? And you feel very normal, no lightheadedness or anything like that? Great, great. Well, Jen, you've been wonderful. Thank you very much for all your help, and you're going to love it.
Okay, thank you.
Always a pleasure.